What is lumbar radiculopathy? Lumbar radiculopathy is defined as inflammation or irritation to the nerve roots of the lumbar spine that result in pain or weakness down the lower extremity. One common cause of lumbar radiculopathy is a disc herniation. Seen here in the blue is the nucleus pulposus, which is the jelly-like substance that will sometimes protrude through the annulus fibrosus, this white material outside, and this will impinge upon the nerve roots in the lumbar spine, causing these symptoms down the leg. Symptoms of lumbar radiculopathy include burning, itching, numbness, or tingling in the low back, buttock, or lower limb region. In severe cases, you can get weakness of the muscles of the lower. A conservative rehab approach focuses on improving the mobility, stability, and strength of the surrounding musculature and nerves of the low back and leg. In the early phases of a lumbar radiculopathy, I'm focusing first on calming the symptoms down. Now, this can be done in a myriad of ways, including a warm bath, medication, manual techniques, light mobility or stretches. But the important thing is that we're getting a decrease in pain to at least a tolerable level. I like the 90-90 rest position in early lumbar radiculopathy, as this takes some pressure off the low back and is generally a good position for people to find relief. From there, we're focusing on light mobility and light stability exercises for the low back musculature and the hips, as this will provide some potential pain relief and start to improve the mobility and stability. In the intermediate stage of rehab, we're still focusing on improving mobility and stability of the low back and the hips, but we can begin to implement nerve glides. Nerve glides are an exercise that actually stretch the nerves, which do actually lengthen a little bit as we do normal movement. And this will do this in a tolerable way, where you can start with certain exercises focusing on proximal parts of the nerves, and then moving to other exercises focusing on more distal parts of the nerves. In the advanced stage of lumbar radiculopathy rehab, we can potentially incorporate some nerve tensioner exercises, which are a progression from the nerve glides. This will tension the nerves in both directions, proximally and distally. Furthermore, in the advanced stage of rehab, we're focusing on any remaining deficits that we may have. Generally, in a severe case, this is weakness to a lower body group of muscles, such as the quads, hamstrings, or potentially the calf or shin musculature. I like to incorporate load in a progressing fashion, whereas strengthening these muscles will likely yield a benefit. Thanks for listening to my brief and simple explanation about lumbar radiculopathy. If you have questions or are interested in one-on-one online training or self-guided programs, please visit the link in my bio. Thank you.